Hi everyone, welcome to our group presentation for the course Exploring Mental Health and Developmental Disabilities, where we are going to be discussing the topic of anxiety disorders. Presentation is by Manel, Emma, Chris, Noah, Mohammed, and Abdullah. Here's our table of contents where we look at the background of anxiety, the types, its importance in epidemiology, the characteristics, symptoms, and etiology, a brief medical diagnosis and treatment plan, non-medication treatments like cognitive behavioral therapy and physical activity, and the portrayal of anxiety disorder in the media. This is the background of an anxiety disorder. So what is anxiety? It's considered to be the most prominent mental health condition on a global scale. If someone has an anxiety disorder, they typically respond to situations with excessive worry, fear, and/or dread. While anxiety is this normal feeling that everybody has, it differs from the normal feelings of nervousness and anxiousness, and it typically involves having persistent and excessive fear or worry. It can be characterized when one's cognitive, physical, and behavioral symptoms of anxiety are persistent and severe, and when the anxiety negatively impacts one's ability to complete daily tasks. It's also worth noting that it is different from the normal feeling because it's not just a one-off occurrence like when you're writing a test. It's a persistent feeling that occurs over time. When we look at the types of anxiety disorders, the first one we're going to look at is a generalized anxiety disorder. And this is when you have excessive fear or worry, typically due to increased stress levels, and it's going to hinder your ability to function properly for approximately 6 months. So when someone comes in to get a diagnosis for generalized anxiety disorder, symptoms should last approximately 6 months. This type of anxiety can cause significant problems in one's day-to-day living, and it can be done whether it's feeling extremely tired, weak, or having trouble with your cognitive abilities. And it's also understood right now as the most diagnosed anxiety condition. Panic disorders are a type of anxiety disorder that involve recurrent and unexpected panic attacks. So you have this excessive fear and worry that occurs, and it reaches a peak within a few minutes to 30 minutes. And you have trouble controlling that feeling or bringing yourself to a sense of reality. Social anxiety disorder, or SAD, is characterized by extensive fear of social situations or gatherings, and it leads you to tend to avoid these types of interactions in society. Another type of anxiety disorder that we're going to talk about is specific phobias. So this is having an intense fear or irrational fear that exists around specific objects that aren't considered to be life-threatening. So some examples of specific phobias that exist is a fear of flying, a fear of heights, a fear of spiders or water, and typically these aren't things to worry about. Your mind is just basically playing games saying they're scary for you. Separation anxiety disorder is this fear of being separated or lost from someone who you're close to, or specifically a family member, and typically this is found within children or young adults. When we look at the significance of anxiety disorders, it's important to understand that it's the most common type or prevalent type of mental disorder that exists within society today on a North American level and on a global level. And what's even more concerning is that we're seeing an increased number of cases or incidents since the COVID-19 pandemic has occurred. It also results in higher healthcare costs, as you have to pay for counseling therapy, prescription medications, as well as the potential for psychiatric or substance abuse rehab facilities in severe cases of anxiety disorder. It also has a high burden of disease because it's often coupled with other comorbid conditions and results in 14% of years lost due to disability. This stat kind of highlights that anxiety is a real and serious disorder, and it's just as serious as other physical disorders like heart disease, stroke, and cancer. And overall, it's important to help diagnose anxiety because it helps to reduce the overall stigma that exists around the disorder, as well as around mental health disorders. When we look at epidemiology, this slide is going to highlight the prevalence rates of anxiety disorder. And the first one to look at is 284 million cases of anxiety exist globally. That's over 284 million people currently have anxiety disorder worldwide. And in the States alone, there's over 40 million that are attributed to having anxiety. The stat for Canada isn't well known yet because it hasn't been reported. The most recent percentage of Canadians to have an anxiety disorder was reported back in 2015 at 1.6%, and 3.7% will experience it for life. This becomes interesting because currently the COVID-19 pandemic has estimated that this number could have risen to over 10%, but hasn't been reported yet. 8% of children and teenagers are considered to have anxiety, while 8.1% of all adults have some symptoms of anxiety but haven't been diagnosed. Women are 2 times more likely than men to be diagnosed at some point in their life. And since the COVID-19 pandemic started, there's been a 3-fold increase in the prevalence of anxiety disorders worldwide. When we break down the prevalence rate by gender, we see that 4.7% of females have it, and only 2.8% of males have it. This highlights that women are 2 times more likely than men, roughly, to exhibit the disorder. However, we don't know exactly what contributes to this, whether it's genetic, psychosocial factors, or even neurobiological factors. The second part here is characteristics, signs, and etiology for anxiety disorder. When we look into diagnosing anxiety disorders among teenagers or adults, there's a diagnostic criterion that exists in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5. And most mental health advocates believe the diagnostic criteria must involve having these feelings of worry or excessive fear for a 6-month period. It needs to be accompanied by an inability to seize control of these feelings and really impact your daily life. On top of these immediate characteristics, it must be accompanied by 3 or more of extreme fatigue or being easily fatigued, restlessness, irritability, an inability to concentrate or having a blank mind, edginess, insomnia, disturbances to sleep, increased muscle tension, and even muscle weakness. In addition, anxiety disorders will typically have a panic disorder attached to them, or having these sudden repeated feelings of intense panic or fear, reaching peaks within minutes, or even persisting longer, and we know those as anxiety attacks. It is important to note that panic attacks aren't always a required characteristic, but could be a type of anxiety disorder that's displayed, and depending on the person experiencing the disorder, they will have a limited number, or they may exhibit all specific characteristics of anxiety. When we look at a characteristic time frame for a diagnosis of anxiety disorder, 6 months is usually the universally accepted time frame. However, it's kind of been a gray area recently because literature suggests that a 6-month-long window of having these feelings may not account for all anxiety disorders that exist. It's believed that it's possible for people to have mild or less severe anxiety than others, and therefore to avoid missing certain diagnoses or preventing people from not seeking medical attention, the definition should focus more on symptoms or characteristics and how much they are affecting your daily life in a negative manner. Some literature and even medical professionals suggest that a constant daily feeling of excessive worry or fear and that negatively impacts your life day to day, and the inability to control this feeling is more indicative of having an anxiety disorder rather than classifying it by a 6-month time frame. But despite this, if you experience anxiety, it should be repeated or a prolonged event, not considered normal for you, to avoid diagnosing someone for normal anxiety that you experience in your life. When we look at specific symptoms that are indicative of an anxiety disorder, excessive and persistent worrying, panic, or fear that negatively impacts your daily life or makes you feel out of control is what the DSM-5 classifies for anxiety. In addition, there's common signs and symptoms like feeling nervous or having pits in your abdomen or stomach, having a sense of panic or this impending doom, increased heart rate or heart palpitations where your heart feels like it beats out of your chest, hyperventilating, excessive sweating both at rest or during activity, trembling, feeling tired, fatigued, or weak, having insomnia or trouble sleeping. You might have trouble concentrating, especially at work or in school. And you might experience an onset of gastrointestinal issues such as diarrhea or stomach pain, and you're going to have difficulty controlling the feelings of worry. In addition, it's also important to note that signs and symptoms get accompanied by disturbances to occupational functioning, social abilities, your sleep schedule, and you usually exhibit an inability to enjoy activities that you once loved. Based on the last slide, I gave you a set of physical and potential mental signs and symptoms of anxiety, but again, symptoms are based on the person that's exhibiting them. So not everyone is going to have the same symptoms, and you're not guaranteed to have every single one. In addition, they could be categorized by the type of anxiety disorder you have. So a GAD might have symptoms related to stress, fatigue, being irritable or having insomnia with muscle weakness and tension. Whereas a panic attack is going to be more physical. You have dizziness, heart palpitations, you have shortness of breath, or feeling like you're having a heart attack, and they're going to foreshadow the other mental symptoms that are indicative of anxiety. And you might also have anxiety with comorbid psychiatric conditions, such as like a major depressive disorder as well, which are important to consider when getting diagnosed for anxiety. So the etiology of an anxiety disorder is actually very intriguing because it's not well understood through literature why they actually occur, nor is it understood what the exact causes are. Most literature agrees that stress is the largest factor associated with anxiety disorders, typically in the form of stressful life events, being part of a persistent high-stress occupation, or having a high stress level for a prolonged period of time, and there's a significant link to generalized anxiety disorders. Comorbidities like diabetes, depression, bipolar disorder, and other physical mental disorders have also been considered as causes that professionals believe to be associated with higher anxiety. These are seen as potential causes because they occur in a significant number of anxiety cases, and they have the potential to heighten overall anxiety that someone witnesses. In addition, there's a genetic factor that might be related to causing anxiety, specifically panic disorders, and accounts for approximately 25% of these cases. There's also environmental factors which look at culture, a child's upbringing, abuse, substance abuse, or increased tragedy that happens in one's life that might increase the chance of having anxiety as well. There's also studies that have been done to show that excessive amounts of caffeine consumption induces greater physical symptoms and psychosis, which in turn can increase anxiety or stress levels. And there's other potential psychological theories like psychoanalytical and psychodynamic theory, behavioral theories, and cognitive theories. However, there's little to no empirical evidence that suggests these theories are sufficient to cause or even that they're related specifically to anxiety disorders alone. Now we're going to quickly look at medical diagnosis and treatment plans for anxiety. So when a healthcare practitioner is diagnosing anxiety, the first important consideration is to determine whether the worry and fear is persistent and excessive, or whether or not it's an occasional feeling. Remember, anxiety is a normal feeling, so it has to persist over a period of time. The DSM-5 is what we use to address patients experiencing episodes of hindering fear and worry. And in addition, people must exhibit at least 3 other physical symptoms in addition to the feeling of fear and worry that persists. And from there, physicians will typically order other diagnostic tests to rule out other potential health conditions, and then they'll begin a treatment plan with either counseling or pharmacotherapy. So the first step when diagnosed with anxiety is typically to seek counseling or cognitive behavioral therapy. Mild case of anxiety, this is the preferred method of treatment because it allows patients to talk about their mental health, find the root cause of their anxiety or what triggers it, and how to cope. Pharmacotherapy starts with an SSRI or an SNRI, and they're going to work on the central nervous system, specifically serotonin or norepinephrine receptors, and essentially slow the brain down from transmitting signals that induce anxiety. They're typically very effective treatments and have the potential to lower symptoms of anxiety, and they actually regulate our mood as well, which is really good. Acetylopram or Lexapro is an SSRI that's typically administered first with minimum side effects, and you're going to look for how patients respond before you determine the next steps. Benzodiazepines such as Ativan are also administered for anxiety, and they're really good for reducing the amount of physical symptoms, specifically panic attacks, because they slow the central nervous system down and allow you to relax. Other medications might be used as well. However, beta blockers, anxiolytics, and other antidepressants aren't typically used anymore as first-line treatment for anxiety. Now we're actually going to delve into the non-medication treatments that are administered and are very successful in reducing anxiety disorders. When we look at cognitive behavioral therapy, or CBT, this is the first non-medication treatment, and it's a form of psychological treatment used for treating a range of mental health conditions, and anxiety disorder is one of them. CBT is going to teach individuals the ability to disengage from avoidance and safety-seeking practices that actually impede someone's ability to recognize and correct any distorted thoughts or impending doom they might have. It typically targets your emotions and thoughts that you have that impact you negatively, especially your behavior, and we're going to help the individual identify a more appropriate thought pattern. So you're going to try to minimize negative thoughts to reduce your symptoms. There's a big emphasis on helping the recipient learn to be their own therapist, and there's a significant importance on what is currently going on in the person's life as opposed to what led up to the difficulties. And this allows you to find triggers, how to deal with them, and how to better cope. And CBT actually consists of in-person sessions where you go through these various exercises or strategies. You have homework to practice exercises outside of sessions. And for non-comorbid anxiety, a course of CBT is usually going to last for 5 to 20 sessions, or for more comorbid anxiety, as long as needed. When we look at CBT strategies, the first one is addressing distortions in thinking patterns. Learning to distinguish distorted thoughts and reevaluating them with improved sense of reality is very important. Usually guided discovery is used, and this is when the therapist tries to understand a patient's perspective and aid them in expanding their thinking and become conscious of their underlying assumptions, negative thoughts, and discover appropriate alternatives. Aiding in the development of an arsenal of problem-solving skills to cope with difficult situations. This looks at thought records, which patients are using to be aware of negative thoughts they have, distinguish thoughts from facts, and determine the impact this has on their mood. Part of completing this is to consider a rational response to difficult situations and prevent that negative thinking from being automatic. Then there's helping the individual to develop greater confidence in their own abilities. You may be asked to keep a positive data log where you observe improved adaptive techniques and helps the patient recognize their improvement and work towards improving their confidence. The second strategy is addressing and changing behavioral patterns, which first looks at learning to face your fears instead of avoiding them. A lot of people, when they have anxiety that's based on fear, will run away from their fears instead of addressing them, and this is important to avoid anxiety in the future. Role-playing to develop skills and handle problematic situations with others is also important, and learning how to calm one's mind is essential in this strategy. This involves active scheduling, which is used to plan each day in advance, and graded task assignments that get used to create manageable steps for handling one's anxiety instead of provoking different negative situations. And techniques help stimulate a greater sense of enjoyment for the individual while helping them claim their mind from anxiety instead of the negative thoughts they may have from day-to-day activities. So when someone undergoes the strategies for CBT, it's been proven through literature that it enhances mental well-being and functioning through facing your fears and understanding what triggers your anxiety. This in turn helps to improve your overall quality of life. It relieves any mental suffering that anxiety causes you. It has the potential to improve your overall self-esteem because you're not thinking negatively all the time. And it's going to allow patients different strategies that help cope with negative thoughts or cope with any triggers that they have that form anxiety for them. When we look at comparing CBT to other potential treatments like pharmacotherapy or potentially physical activity, we see through literature that it's been proven that CBT is effective in treating anxiety disorders. It's also effective for numerous psychiatric conditions like depression as well. A study by Fenn and Byrne 2013 actually discovered it's probably the most successful first-line treatment and can be more effective than pharmacological methods because it's actually looking for the root cause or trigger for someone's anxiety rather than giving them a medication that's going to work on the nervous system to make them feel better or improve their mood. Having CBT as part of your treatment plan is going to allow for improved mood, self-esteem, and a way to cope with your triggers rather than taking a pill for them. So looking into the effectiveness of CBD, a study by Kodal et al. 2018 examined the long-term effectiveness of CBT in young adults aged 11 to 21 who were diagnosed with anxiety disorders. The study examined the long-term outcomes of both individual and group CBT among 139 youth treated in community mental health clinics. Outcome measures were evaluated at a baseline and at 3.9 years post-treatment. Outcome measures included a loss of inclusion diagnosis of anxiety disorder, a loss of principal anxiety diagnosis, and any changes that happen with their anxiety symptoms. The results of this study indicated that a loss of all inclusion anxiety diagnosis occurred in 53% of participants. A loss of principal anxiety diagnosis was found in 63% of participants, and there was also a significant reduction in all anxiety symptoms. There was no statistically significant relationship between participants who received individual compared to group cognitive behavioral therapy, but the study overall shows that it is effective in minimizing anxiety and potentially reducing it in the future. The one problem that this study has is it doesn't actually specify what anxiety symptoms it looked at for CBT treating, so we don't know if it's as effective for treating one anxiety disorder compared to another. There's also a small sample size, and the outcome was only measured at 3.9 years after treatment. Therefore, we don't know if CBT is beneficial beyond that time frame. Our second non-medication treatment is actually going to look at physical activity, which has been proven successful in reducing our overall anxiety symptoms. It offers a protective effect against anxiety disorder. Physical activity includes any aerobic exercise that includes walking, running, swimming, biking, hiking, and a variety of other cardiovascular training methods. And physical activity actually has applications in treating anxiety disorder because it has the ability to self-regulate, especially our heart, through biological and psychological mechanisms. Essentially what this allows us to do is regulate our heart rate and improve physical symptoms that may exist from anxiety, but it also helps to improve mood or morale, and therefore it has potential to be linked to improving our mental status, especially with an anxiety disorder. When we look at physiological mechanisms and how physical activity impacts them, the hypothalamic pituitary adrenal axis is responsible for physical and psychological stressors. When there's an irregularity to these, it increases anxiety symptoms. Physical activity has actually been proven to reduce the irregularities and reduce stress, which reduces anxiety. The monoamine system gives us this helplessness feeling, which is indicative of reduced serotonin levels and norepinephrine. Exercise has been proven to increase both brain chemicals, which give you this feel-good mood. We have an opioid system, which regulates mood and emotional responses. Exercise has the ability to boost morale, mood, and overall reduce any anxiety symptoms. And these are just a few of the positive effects of exercise with our physiological mechanisms, but there's a vast variety of more that will impact anxiety as well. When we look at the benefits of physical activity, studies have shown that physical activity is linked to improving self-esteem and confidence, so those people who work out or partake in cardiovascular activity have an ability to be more confident. It improves mood, morale, and has a sense of well-being. And it reduces our anxiety symptoms through regulation of our heart. So this can include irritability, sleeping problems, feeling restless, being easily fatigued, as well as any physical symptoms like heart palpitations that may exist with your anxiety symptoms. When we look at investigating the effectiveness of physical activity, our study was done by Aylett et al. 2018, and it was a systematic review and meta-analysis to assess the benefit of exercise as a treatment option for anxiety and how it's related to symptoms. A total of 15 studies were analyzed with over 675 participants. The results of the study concluded that engaging in aerobic exercise was effective as a treatment for anxiety, as it had the ability to regulate our heart and improve brain chemistry through the increasing of our feel-good chemicals, which induced a positive effect on the body and reduced overall anxiety symptoms. The study further concluded that high-intensity exercise, specifically in the form of HIIT, high-intensity interval training, presents a greater benefit than low-intensity exercise, but all physical activity is beneficial, especially when looking at reducing anxiety symptoms. Possible critiques of the study is it's a small sample size, so the applications of conclusions are limited. There's a wide range of delivery mechanisms, so it's hard to find the most impactful one, and there may have been study bias because of the exclusion of all non-English language studies that existed. Finally, we're going to look at the portrayal of anxiety disorder as seen in the media. When we look at the portrayal of anxiety disorder, media plays a significant role in actually shaping social discourses that surround mental health, as it has the potential to reach millions of people and actually shape their opinions. Since media, whether it's on the television or social media, reaches so many worldwide, inaccurate portrayals of anxiety can actually heighten overall social stigma and leads to mental health discrimination in the world. This in turn has been proven to inadvertently reduce people from seeking medical attention that they need and also makes them feel like a potential burden on society. With that said, let's look at a specific example of anxiety disorder as portrayed in modern television. For the portrayal of anxiety disorder, we focus on Raj Koothrappali, who is a character from the famous sitcom Big Bang Theory, which aired from 2007 to 2019 on CBS. Raj is said to have a mutism or severe social anxiety disorder, which prevents him from partaking in specific social situations and acting like himself. One thing that is greatly impacted with his disorder is his potential to talk to people, especially people he doesn't know, because he's so uncomfortable or scared to interact. This disorder is heightened when he talks to women, so he tries to avoid them altogether. If he does interact, he comes across as this awkward or offensive character who is adored for his flaw, so basically he is used as comedic relief for the entirety of the show. He is also seen as an alcohol user, which he uses as liquid courage to overcome his fear of women, but in reality it makes him appear obnoxious or offensive. He also takes experimental anxiety drugs, which he believed to help. However, they have a multitude of different side effects that affects him as a character. So this leads us to the question, is this really a true representation of social anxiety disorder or anxiety disorder in general? The answer to this question is no, it's not an accurate depiction of social anxiety disorder, let alone anxiety disorder at all. In the show, Raj's social anxiety is only apparent when it comes to talking to women. In reality, social anxiety disorder is nowhere near this specific. The disorder manifests itself pretty much in every area of an individual's life, to the point where an affected individual will commonly avoid all social situations or all social interactions. In addition, while social triggers can be specific to girls or talking to girls, it's likely there will be other factors that induce the anxiety response, and that makes it difficult for that person to function in day-to-day life. Raj does not accurately portray the monumental effort it can take for an individual suffering from anxiety disorder to involve themselves in social situations. He doesn't seek any counseling or proper medication therapy. And when he does use alcohol, they use it as comedic relief. And this is actually dangerous because it emphasizes that if you use alcohol, you might be able to overcome your social anxiety when in actual fact, it might induce greater anxiety or potential substance abuse. In later season, Raj essentially overcomes his social anxiety altogether when he meets his girlfriend. The portrayal actually romanticizes the disorder. In reality, overcoming social anxiety is not as simple as finding a girlfriend, and it is typically a lifelong journey that many patients have. So looking at the impact on stigma, in the absence of actual experiences dealing with people with a mental illness, individuals will rely on the media for their perceptions of what a mental illness will look like. Media negatively contributes to the stigma through exaggerated, inaccurate, and comical portrayals of people with mental illnesses, such as anxiety disorder, and this really perpetuates the lack of knowledge that exists behind it. Although the show is meant to be comedic, the portrayal minimizes the lives and realities of those who actually live with the social anxiety disorder. Raj really contributes to the stigma by inaccurately portraying the range of symptoms, conditions, and effects that it has on people's lives. And it even hints that alcohol can help anxiety by taking away your symptoms, but in reality it's far more dangerous, and this can actually lead to potential substance abuse or misuse, which poses more risks to a person. In addition, viewers may internalize the perceptions and the realities of anxiety disorder are greatly misunderstood. And finally, this is significantly problematic because this stigma has the potential to minimize the number of people who seek help, leading to internalization around the disorder, and this has significant negative effects on mental health. It also makes people feel like a burden and belittle themselves, which isn't what mental health advocates want to see in society today. So in conclusion for our presentation, we see anxiety disorder as a very prevalent mental disorder that's rising globally. While a specific etiology is not yet understood, knowledge should be spread so that increased awareness surrounds this disorder. Anxiety can be treated in a number of different ways, from pharmacotherapy to behavioral therapy to physical activity, all of which have been proven effective treatment methods for minimizing anxiety disorder and minimizing the overall symptoms that occur with anxiety. And finally, mass media and stigma play these big roles in preventing people from seeking the help they need. This leads to perpetual misunderstanding around disorders. Therefore, I think more knowledge is needed so we can reduce stigma and overall increase the number of people seeking help, because in today's society, mental health is such a big thing that we need to increase understanding and make it seem okay for people to embrace their mental health and seek help. And really, thank you for listening to our presentation on anxiety disorder, and hopefully you learned something or can help someone that exhibits anxiety disorder in the future. And these are just our resources we use for the presentation.